Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show podcast. My name is Kirk Behrendt, and I have one goal here, to bring you great thinking from new rock stars and existing rock stars to help you improve your practice and your life. And today we do exactly that with a new rock star. Her name is Dr. Tiffany Lamberton, and we talk about the 3 keys to identifying the early high-risk TMJ patient. She's up to some pretty cool stuff. So I want you to listen up. I know you guys will enjoy it, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. You know the GM. I have one job here. It's to find the coolest rock stars in all of dentistry and share information with you so you can create a better life and a better practice all together in one. And I've got a cool rock star on today, Dr. Tiffany Lamberton. And we're going to be talking about 3 keys to diagnosing early high-risk TMJ patients and putting all of this together so you can think better. So, Tiffany, thanks for being on. I appreciate you.
Thank you so much for having me. It's an honor.
Yeah, I am so grateful. And as you guys are going to see, or you're going to hear, she's an awesome thinker. And so I want people to know who you are before we get started on this important topic. So give us a little bio. Tell us your story.
Sure. Well, and I basically fangirl stalked you back in November at the Pacific Northwest Dental Convention, which was the first time I'd ever spoken at a big meeting. And I was like, okay, I have to be on your podcast. So you're like, okay.
Yeah.
So I have dual degrees in physical therapy and dentistry. And so I did PT first, worked as a PT for a while in the Seattle area. And then, I was back down in California because my husband was going to medical school. And I was like, I think I want to go to dental school. And my dad was a dentist and he was like, I don't think you should do that. That seems like a bad decision. But nobody could talk me out of it. So I went to dental school and, I was really struck by the fact that we had such little education on the temporomandibular joints, kind of from an orthopedic standpoint, and in anatomy, my classmates were complaining, why do we have to know the nerve supply of the gastrocnemius? I'm going to work on teeth. Why do we need to know all of this stuff? But I was like, oh, I love this stuff. I was the one that loved, gross anatomy and, oral pathology and all of that stuff. And then when it came to the clinic, we had to practice on the plastic teeth with the typodonts. And I was like, woo, I don't know if this is my jam or not. But I stuck with it. And, then I just started to think there needs to be a way to bring the joints into the picture more because, we always are just very focused on the teeth and how they fit together and the bite and the occlusion. But, I always think of if you're building a house, Kurt, and you do these beautiful front door, you're building this entryway, you spent $40,000 on these doors and the hinges are $3.99 from the hardware store, you may run into problems. And so I think that as dentists, we need to have a little bit bigger lens of looking at the jaw joints, looking at, more the muscles of the head and neck. Myofunctional therapy is really big right now. When I spoke in November at that conference, I just had a plethora of people come up to me and say hey, tell me more about myo, how do I get into it? Dental hygienist, how do I get certified? How do I bring that into my practice? I really just owe a lot to my mentors. I met Dr. Jim McKee, who you know well,
Right.
back in 2012 at the CDA, and I was just riveted. I was like, finally, someone is talking about the joints in an orthopedic way. So I, went up to him afterwards and I was like, your message was like really powerful. And as a PT, it really resonated with me. And he was like, come out to Chicago. And I was like, really? And he was like, yeah. And him and his wife, Lisa, are just incredible people. And I just, so fabulous. He's been such a mentor to me all these years. I just keep following him around. And now he's got this amazing Chicago study club. And he's brought in all of these rock stars. You've had several on your show, Kurt Ringhofer, Drew McDonald. It's just this incredible group of dentists that every time, we meet, whether it's virtually or in person, I'm always just like excited and inspired to keep going. And so I guess like through the pandemic, we all decided we had to kind of like look at our lives and do something different. And so for me, it was finally that chance to kind of step out there and be like, I want to kind of do what you're doing. I want to be a mentor to young dentists. I want people to focus on like a bigger lens of, looking at oral health in like a new way. And, I think that also as more women are in dentistry, I think we tend to be a little more collaborative
Yep.
and a little more nurturing, and so I preach a lot of just like a comprehensive exam combined with like modern imaging. And that's what I've really learned from, like I said, Drew and Kurt and Jim and all those guys. It's just, you want to stay humble and stay curious and never stop learning. So that's kind of where like TMD Collective was born, because I really want to just not just me practice in a TMD practice, but I also want to teach other dentists kind of like all of the things that I've learned as both a PT and a dentist, and kind of like bringing it all together.
Yeah. Yeah. So I have so many questions. What do you do a lot? I mean, first of all, your study club's amazing. Those people are awesome. All of them.
I call it my bougie study club because I had to give up everything else and just pay for that.
Yeah. The only thing I don't like about the study club is the name. I told him it's Chicago Study Club, and he's like, "No, we're not changing it."
Yeah.
Yeah, and it's only because I'm in Milwaukee, and that just lends itself to a great sports conversation. So, but I think what they're doing is incredible, and out of this, I think where you're headed is tremendous. Can I ask you this one, Tiffany? And talking to a lot of dentists, where do you think they get this wrong? Like, what's the essence of what they might get wrong in this thinking?
I mean, I think that there's a lot of myths as far as just like telling people, oh, you have clicking and popping, you're fine. Or like, oh, hey, your joints look like, they're really degenerated, but you're just going to be fine with that. I give the analogy if, I have an 11-year-old and he's like an incredible skier. We were just up at Whistler and like, he's doing hits and he's like in and off of the runs. And, if he had a bad ski injury and injured his knee, let's say his medial meniscus, ACL, some of the soft tissue of the knee, you wouldn't even think twice about ordering an MRI to evaluate, are we going to do PT and a brace, or are we going to do arthroscopic surgery? And so I get a little bit frustrated when I start hearing so much pushback about like, well, why do you need an MRI of the TM joints? Like, why would you do that on someone that doesn't have any pain? And so in my own kiddo, just kind of like, as I've gone through kind of my journey of like looking at airway, even for me to, start having some concerns about some of the things that I was seeing back when he was like 5 or 6, and, talking to the pediatrician and I was lucky. My brother-in-law is a sleep physician. And so I had to push really hard for him to even have a sleep study. And when he had his sleep study, he was having 17 events an hour, and because like Jeff Rouse is your guy, he's the airway through, I mean, I almost started crying as a mom because I was like, what? Like, this is my jam. Like, I know all this stuff. And like, he was having all of this stuff that, nobody was paying attention to, or they just kind of wanted to kick the can down the road. And I'm not like faulting that, but I'm just saying that, like, as we're starting to see these things with airway, and as we're starting to look again at occlusion and the bite, so for him, he was starting to have, this midline shift where I'm like, hey, his chin is off to one side. I'm seeing that his mandibular ramus height is shorter on one side versus the other. But I kept going to like orthodontist after orthodontist until I found Drew.
Mm-hmm.
And then like Drew and I like totally think the same way, and it's like, well, he's had a fall on the chin. He's had a fall in kindergarten, concussion. He's had a fall, again, over and over again, where I think especially our like young female patients, where they may be like a little bit hypermobile, or they may have like more ligament laxity, or, basically where you have a series of things, I have maybe like they had a gymnastics injury, they fell on the chin, or like they fell off the rope swing. And as a dentist, or especially as a mom, you're like, are your teeth okay? Like you knock out your,
Right.
you're like, are you bleeding? Like, do you need stitches? But like, no one thinks about the jaw joints, right? And the issue is that, even if you have a little bit of displacement of the disc, that's going to affect the growth of the condyle early in life. And so when you're thinking about, craniofacial defects, and as we're starting to see different bite presentations, we used to call it cheerleader syndrome with these, like, and they used to say, well, there's all these like young females with anterior open bites and they're running around, maybe they're yelling too much. It turns out, as from just talking to, Jim and Drew and those guys, is as we're starting to get better tools with our modern imaging and correlating that with our clinical exam, we're realizing that like not all TM joints are normal, or not all of them are healthy, and not all of them are reaching their full growth potential. And I would say as a PT, also, we're looking at upper cervical. So Drew and I just did a virtual meeting back in February for the Chicago Study Club. And I was just the warm-up band and Drew was the rock star, but mine was all about like upper cervical, like C1, C2. And what we're seeing is like rotations of atlas in these young kiddos. Even though they may not have a lot of pain, they may be starting to have other sympathetic symptoms that are manifesting as maybe like headaches or postural changes. And so I think that what I want to manifest is this like crystal ball of, so rather than having that, maybe 45-year-old patient in my chair that's crying because she can only open, 2 finger widths, because her jaw is locked closed after she had her restorative work, what if we could go back in time, or, now as we're moving forward, as we're starting to look at, kind of interceptive and ortho and these kids that are younger and younger, and we're starting to see things like cross bites or anterior open bites, or, bite changes and postural changes, muscle changes, and that's where I think the myofunctional therapists are really like our advocate, because they're like looking at them in different ways. As a PT, we're just like so used to collaborating. It's like you have a complex patient, you want your speech language pathologist, you want your OT, everyone has kind of like a little bit different perspective. And rather than being kind of like, well, I'm going to just be stuck in my silo and only look at the things that I know, I want to encourage that general dentist to be like the leader of the team. And I see the future of like these big centers where we're all like collaborating, with like the sleep physician and the ENT and the myofunctional and like the PT and the body worker, you start getting into like myofascial release and, all of those things. Is like, as a PT, that was like no big deal. But I think dentistry, with how we're trained, we're just very focused on the teeth. Yeah. And so I think we need to have like I said, that bigger lens of looking at things as we're learning more and more about how all these systems like work together and function in our patients. So
Yeah, I love it. I love it. And I want you to go through, let's go into that lens that you just mentioned. And when you talk about the three keys, walk us through this framework, which I think is brilliant, and how you describe it to other dentists.
Yeah, like I said, I mean, I think that we need to start training ourselves to utilize the tools that we have available to us. I'm friends with a lot of endodontists, and I say to them, would you ever want to do molar endo without your microscope, without your gentle wave, without your CBCT? And they're like, no, I could never go back. Right. And so I think that, when you start seeing things like in the airway world, if you start seeing, that kiddo that has the tonsils that are kissing on the midline, or you see the kiddo that can't even like lift their tongue from the floor of the mouth, or you see that mismatch between, the maxilla and the mandible of the kind of the growth and development, kind of once you start seeing those things and starting to look through that bigger lens, I think you just can't unsee it, right?
Right. Right. Yeah. And so when you were showing me the graphic beforehand, and we'll talk more about TMD Collective, but walk us through each point on that triangle and how I can think about that as a listener.
Yeah, I mean, I think that airway dentistry is really amazing. I think the paradigm is shifting where there's a lot of dentists that are getting excited about airway and realizing, that the oral pharyngeal airway space is really kind of like our jam, and we can impact that, especially in these young kiddos. But I want us to think more than just putting in like a mandibular advancement device, because I do think that back when I was kind of just starting to delve into the sleep and TMD world, if you start to change the position of the jaw, you realize that like you need to know kind of what the condition of those joints are before you start doing that. Because if the patient ends up having maybe some subpar outcomes, maybe they have some bite changes, maybe they start to have clicking and popping of their joints, maybe they start to have pain, you want to know kind of what your starting point is. And I think that that's what I really want to emphasize to, I know you have a lot of young dentists listen to your show, is really in the beginning, let's slow down to get the diagnosis. Because I think with dentistry, we're so quick to like jump to like, okay, this is a great case. I can really fix these things, and, I can change your bite. But you've got to know that those joints are stable. So no matter what your treatment proposal is, whether it's ortho, whether it's, referral to an oral surgeon, whether it's restorative dentistry or equilibration, my message would be like, let's slow down and let's look at all those 3 points of the triangle. So airway, myo, I kept it myo because I didn't want it to just be about like tongue tie. I want it to also be like the muscles of the head and neck, and the muscles of mastication and the myofascial planes, because I think we're starting to realize how that part of it plays into it. And then I just don't want us to forget about the joints, because like I said, those are the hinges. And if those break or aren't functioning properly, you're going to really start to see how it affects other parts of the system. You're going to start to see how it affects the neck and the cervical spine. You're going to start to see how, if you start looking at your patients, their sternocleidomastoid, or like maybe they have like a torticollis in their neck, or, you start to look at how they're holding their body or how they're moving. And so I think that we can't leave those things out as a general dentist. Like I said, I think we're perfectly positioned to be the leader of the team and to really be, kind of bringing all these different collaborators into our orbit. And so I want to encourage, just like, don't be afraid of that. Don't be afraid to start. Like, if you don't know that much about imaging, my husband made fun of me, but like, I just bought this book.
Oh yeah.
He's like, babe, is that book coming to bed with us? It does have an ebook too. But the author, she's amazing. OMFR, Dr. Tamini. I've taken classes from her. She teaches for beam readers. Drew knows, I just think that like, our friends in the oral maxillofacial radiology world, we've got to be talking to them. Right. And if you're taking those big full field of view CBCTs that look at airway and upper cervical and the TM joints. I always do an overread with my OFMR. Like they're just they're an important part of my team. Even though I know a lot, I want to make sure that I'm not missing anything.
Yeah. So go back to when you look at this, I mean, this is great. This is a great framework for how to look at it. When you could probably start anywhere on the triangle, whether it be airway, TMJ, or, mile. And as long as you understand getting to each one of those points and seeing how they're interrelated, you can start to solve or better solve the patient's puzzle. Agree? Is that how you're looking at it?
Totally. Yeah. And I think, back in the day, we used to think that splint therapy was like the only thing, and so then I don't know if you had a patient like this where you made an appliance and they're like, oh, it's great. It's wonderful. Then they come back 6 months later, I'm having all this jaw pain again. And so you adjust, and then, or maybe you have your assistant come in and adjust. And then you're like, oh no, she's back. She's come back 6 months later and it's broken or and so again, I think that, whatever type of appliance you're doing, just knowing kind of what your starting point is really gives us that prognosis discussion. And it really lets us, tell our patients, this is your anatomy. I tell my patients, you want to own your anatomy because, no matter what you do, if you didn't tell them about it ahead of time, it's your fault because you did that crown or you did that splint and all of a sudden it changed everything.
Yeah.
You changed the load.
Absolutely. You have a unique perspective. You're also in a great town that entertains this conversation. I mean, your town is amazing. You're also in
people in Seattle, Coyce and Frank Spear and, the Kinzers and Rebecca Bachhout. And I'm just in awe of, all, Ashley Hoders, I just feel so lucky that I can collaborate with all these people in my area for sure.
Okay. So I'm going to play the dentist who isn't in that area. As you already know where I'm going with this is, okay, so I totally understand. This is a great model, but okay, so let me throw two challenges that I get all the time. I would imagine, and I'm making an assumption, the myo part of it is the hardest. Myofunctional therapist, you don't understand. I'm in a town where it's hard to entertain this. You have a great perspective. You're in a great town. What would you say to a dentist who's listening? It's probably in their 30s saying, I totally love this, but you don't understand, Tiffany, where I practice. What would you tell them? Help me think better.
Yeah, I would tell you that one of the things about, kind of COVID that came about that I think has been great for dental education is that's how I found you, was basically spring of 2020 when we're all stuck at home and you stepped up and you started to bring all of this virtual CE to all of the dentists and start connecting us because we were all hungry for information, whether it was what do I do about my practice? What do I do about, masks? What do I do? All this stuff. We wanted that information. And what's cool is I think that myofunctional therapists have really jumped on that virtual model as well. And so even if you don't have someone right down the street from you or you haven't hired, I would say as a dentist, first of all, talk to your team. Who's excited about this? Who wants to be certified? Or sponsor someone to get certified. One of my colleagues in the Chicago study, actually a couple of the female dentists there have paid for a person and their team member to become a myofunctional therapist. I'm like, yes.
Love it.
Or also, look into these big networks. Social media has some incredible myofunctional therapy communities. As the Breathe Institute is incredible as they're educating. So there's a lot of different ways to connect virtually as well and find out, is there a myofunctional therapist that is just outstanding, rock star in their right that would take virtual appointments, So, this week I'm going to be meeting with one of the myofunctional therapists in my community and, how do you want to work together? Are you on your own and you just want referrals, or are you interested in being hired? Or, like, I think just finding your people and not being afraid to, kind of look out there in the metaverse and find those myofunctional therapy, providers that are eager to work together with you and learn with you.
Yeah, absolutely. And one of the things that you and I were talking about before we hit the go button is, sometimes you just got to get started. You don't have to get this perfect. And there's going to be things you're going to learn along the way. I want you to go back to, I love when you said slow down. That is I totally love that. And it goes counterculturally. Why would I, and again, I'll play, and the reason I do this is I talk to so many young dentists, and you do too. And they're moving so fast that I'm like, come here, buddy. Like, you could do so much better if you just slow down. And like, you don't understand. I have to move this fast. Talk about slowing down. What's that mean? And how do I implement that in my practice to make this work?
Yeah. And that's the thing that I am struggling with a little bit right now is just, I've decided to start a new practice from scratch as a fee-for-service TMD only practice. And so, how do I create that value for like my education, my services, my 2 degrees? They weren't cheap.
Right.
I just listened to that podcast that you just did with Howard, and he kept saying like, all these dental students, they're coming out with $350,000 worth of dental school debt. And I'm like, that's what I came out with. They're coming out with like over 500,
Right.
K. I mean, I just did like dental action day with like some of the UW kids, these D1s. And I'm like, how much is dental school these days? And they're like, it's like 500,000. I'm like, the debt, like the crushing debt of dental school, we've got to figure out a way to not let that to be an anchor and limit how we think and how we practice, right? And I think that we've got to maintain, and create that value for the patient that like, hey, yeah, you could maybe go down the street to that DSO where, not to really shade DSOs, but I've worked for one of as a new grad, and I kind of understand it's like a business model, right? And so, do you want this crown or do you want to, and I just like, I never really liked selling. That felt really uncomfortable for me. I wanted to know that like I'm treating my patients like they're part of my family. I want to hear their story. And so, like I said, I've decided not to do insurance. I think that TMD ends up being this kind of weird gray area between medicine and dentistry where it's not covered well to begin with by really either. And you can spin yourself and your wheels, like trying to generate all these like narrative reports and this and that. And I think it's better if you're interested in doing this to do a fee-for-service model style of practice. And even if you have a restorative practice, just pick out, Dr. McKee always says, like, just pick out 3 patients that you're going to work up this way this month, or maybe 2. And just do that slow process of gathering all your records, your photos, your digital scans, deciding after you've taken that clinical history, are there like enough check marks that you're thinking like, hey, I think that this person may have some issues, whether it's like pain or like jaw deviation, maybe limited range of motion, maybe headaches, or like I said, maybe in this young kiddo, you're seeing these bite changes. And you're seeing like growth patterns that like there's that mismatch between the maxilla and the mandible, or you're seeing some concerning things about how, it's not just about getting the teeth fit together. It's also like, how are they growing?
Yeah.
And so that's what, I've learned so much from Drew, kind of going back to my son, and that really like changed my whole perspective of like, my kiddo may not have any pain, but I'm seeing these growth and I'm seeing these concerning things with his bite. And I'm seeing these concerning things with kind of this whole picture of like his health. And I want to just slow down and get the diagnosis first. I can't even remember what the question was.
That's okay, because I got your back on this. So, some of the magic words you use, I mean, once you see this, you can't unsee this. And I think you could comment on this, like TMJ and airway. It's not going away.
No.
Like there's not a shortage of this stuff to talk about with your patients.
10 million people. Yeah. 10 million. The NIH tells us 10 million people worldwide have TMD, and females are twice as likely as men to have it. And, my question is like, why are we ignoring this? Or why are we waiting until they have pain or problems? Like if we could do that interceptive ortho, and like I said, there's so many rock stars in my study club, Dr. Courtney Donko, she's doing amazing stuff. She's taken over, Dr. McKee's practice, and just, I love how all of these people, like you said, what you bring in to your show is like all these experts, because like as a dentist, we can't be fantastic at everything, right? But we can bring people into our orbit that like have that different lens, and then that pushes us forward in our learning. So, I mean, I'm a total CE junkie. I can't stop.
Yeah. And, I love to have fun with all these people too. Like Jim McKee is one of my favorite of all time. Not only did he help me as a kid getting started in this, but he's an outlier, because there was a time I was looking for him on the internet, and I joked with him. I'm like, I don't even think you're a dentist. I've been looking for you. I can't find you. Don't even have a website. And like, this is before email, and he's crazy busy. So his advice of do well by a few patients. It's amazing when people come to you and they ask you to help them solve this riddle. And what he helped me understand early on is like, people aren't paying for crowns. They're paying for you to listen to them, figure out who they are, and help them solve each one of their unique problems. And your story is so inspiring. And these are some of my favorite, Tim Harry, another young dentist in Kansas City. He's like, I just started helping one mom with one kid. It's crazy. And then another one comes in, and there are weeks I don't even pick up a handpiece, and he is wildly productive. And so I think the important message here is, Tiffany, is once you learn something and you get excited about it, you can build the practice where you're solving these problems, and people come to you and they pay your fee, correct?
Getting there.
Yeah.
Making any money yet.
Hey, but everybody's got to start.
Only 1 year. So I cried all the way home from my accountant's office in taxes.
That's okay. Once you get out of that window of the year and into the second year, that's when it becomes fun. And there's nothing better than helping people with something you've been trained to be really, really good at. Gosh, there's so many questions I have. I want you to talk about what really, you mentioned a little bit, but when you talk about TMD Collective, it's a very cool, exciting thing that you're up to. Can you just talk a little bit more about it, what it is, and if I'm listening, how do I find out more about it?
Yeah. So it's like I was telling you kind of in the pre-show, I would love to be kind of like in your situation where I'm doing coaching and mentoring and really building an educational platform. So it's very much in its infancy, but if you're interested in any of my videos, tmdcollective.online, I've got a few things that I've gotten started there. Like if you're interested in kind of a version of, kind of what I did with Drew for the Chicago Study Club of like why the C-spine matters to the general dentist. But I want to kind of, look at that myofunctional therapy community, because I think that those individuals are going to be so important to supporting a general dentist practice. And so educating them about what we know, whether it's about what we know about occlusion, whether it's what we know about appliance therapy, it's educating them about what we know about sleep and airway, what we know about growth and development of craniofacial complex. I want to bring all those people in and just really guide and create like a community and educate all of those individuals that really are excited about they're seeing these things and they want to know more. So I'm not even ADA CERP yet. So if you have any that's on the docket, all of these things like I've got in my head. Next month, I'm hopefully going to be launching my podcast, Jaw Talk with Dr. Tiffany. I want to have all my rock star friends, Drew and all of those people on my show. But same thing, it's just really starting to create a pathway for like understanding TMD better so that we're not scared of it. I think that when you start to understand modern imaging and how that correlates with our clinical exam, all of a sudden it's not scary anymore, because
Right.
you know exactly what's going on. And you can tell the patient, hey, instead of like this beautiful ice cream cone, your condyle looks like a high-heeled shoe, because it looks like, you have these really degenerative, condition. And so I think that like really with our young patients, especially if we're starting to see, changes with their growth that are concerning, as far as, that kind of that mismatch between the jaws and with the cervical spine, that's when we can really make the most difference to these young kiddos.
Yeah. Awesome job, Tiffany. Well, we're going to be there to support you as you launch this great initiative in dentistry. So any last thoughts you have before we say goodbye to our listeners today?
Yeah. Do Pilates. I'm a huge proponent of Pilates. I think as dentists, you're in these like terrible postures all day, and you've got to find a way to preserve your spinal mobility. You've got to, I was listening to a couple other podcasts where you're like, you've got to be able to practice and like, take care of your body for the next like 20 years, 30 years, and so one of the things that I love is both, I'm also certified in Pilates instructor as well as a PT. And so I just think everybody should do Pilates. I hope when I'm like 90 years old, I'm still like on my reformer, like doing all that stuff. And I think that Pilates really embraces a lot of the principles, of like spinal articulation, flexibility, but also like core strengthening. And so both, a lot of times if I'm seeing a TMD patient and they've kind of graduated from my care, that's the thing that I'm telling them, like, let's keep going. Let's keep the progress. So I'm a big Pilates person.
Yeah.
I have it on my list. Stay humble, stay curious, find your people, and do Pilates.
I agree. That's a great list. My wife does Pilates. She loves it. So I would totally. I got to get involved. I know. I know.
Pilates.
Yeah. I got to get involved. My team actually made me do goat yoga last week. So I was like, okay, that was pretty fun.
Totally.
Yeah, it was awesome. Yeah.
Good stuff.
Well, thank you so much for being on, Tiffany. I really appreciate you. Yeah.
I really appreciate it.
We'll stick around. We'll say goodbye to everybody else. But thank you guys for listening to the Best Practices Show podcast. If you enjoyed today, just do us a favor, hit the share button. I'm going to encourage you to check out Tiffany's TMD Collective. We're going to put a link in the show notes. So I don't care if you're listening to Spotify, Stitcher, iTunes, wherever you consume your podcast, just flip up to the notes. I always do this. You guys, I ask people, are you taking notes? And they go, no, don't worry. We're taking notes for you. So if you flip up to the notes, you're going to see a link to all of those things that we mentioned. You can click right on the link. It'll take you directly there, and make sure you check it out. So keep sending us suggestions. I got a bunch today, and I appreciate you guys. We'll keep bringing it so you guys can create a better practice and a better life. So until you hear from us next time, or you see us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.